You know what?
Or, sorry, PT, do you do
PT,
4?
I do 4, so it will be easier. So here, you guys can see this part. That's your navicular. You find the medial malleolus. So that means that your PT is coming right here. Find the medial malleolus. The first tendon is the PT. Okay? Good. So that means if the PT is there, my incision has to be there, isn't it? Okay, so my incision is gonna be, one incision is right here like this, okay? From here to here, okay? Then we go here. The PT, you're gonna find the medial border of the tibia. We already agreed the orthoplastic approach to get anything or do anything that there will be a centimeter. So you go at the distal 1/3. Okay. You guys follow me so far? So if you do it right inferior, easier. But if this is a patient that you're dealing with wounds and all that, do it this way, okay? But the way that it's described in the literature is right on the border, okay? I just that's my own modification. Same level, you go to the anterior compartment, which is, you feel the tibial crest, a centimeter. Let's do this. You're gonna go right here. Tibial crest. So what did we say? Orthoplastic approach will be what?
1 centimeter posterior.
1.5. 1 centimeter here, 1.5 here. So just someplace here. Okay? So you make them the same length so you don't struggle too much. That one, that one. Then the one on the foot will be where you want to go. If you want to go, if you want to have more dorsiflexion, it's really right there on the neck of the tailors. Okay? If you want dorsiflexion and pronation, will be then the 4th metatarsal, any place in that area. The further you go, more proximal, you're gonna have what?
More pronation and less dorsiflexion, or you're gonna have more frontal plane.
More pronation, more supination, more dorsiflexion.
Oh, that would make sense.
That's right. So the further you are close to the toe, you're gonna be able to move the foot further up. The further you go here, it's gonna pronate more. Okay, so remember that. Okay. Okay, so let's do this. So just go right inferior to the, not here. Tarsal tunnel structures are there. Never I want. So medial tuberosity, medial navicular. Just go right there. Okay. And you can see your PT there, okay? So let's do that. So let's identify them first. And tendon passers is the instrument that you want, okay? Then let's go here. So we can just, let's do this, we go like this. Okay. Stay on the inside border of it. I'm gonna kind of do these here a little bit. Let me have another long curve stat, so we can identify these easy for you. Okay. So then you can see here there's 2 tendons. Don't get full. Check this out. You want to go the one that is right behind the tibia. So you feel the tibia slide down, and then you know it's that one. Okay, I'm gonna show that again. Take the tip, hit the tibia, down, okay? And it's gonna be the tendon that is gonna slide. And open here. I'm just trying to show you guys the tibia. You see the tibia will be right here. I'm gonna open a little bit more than what I usually would do. but so you guys can have an idea. You guys see the tibia there? You guys?
Yep.
Sure? Okay. So then, it will be this one here. Okay.
And this is the incision that you do if
Yeah.
you're doing a PT recession to you guys. So
You got it. Anything there, orthoplastic right now. So it will be a centimeter all the way here, centimeter, centimeter, centimeter. Anything right there, orthoplastic. You go to posterior, you damage your posterior tibial perforators, your medial pseudo perforator. If it's too close to the tibia, too close to the bone, it may not heal right. Okay? So, check it out. So we're in business. Okay? We're gonna do this. Okay. Dilate this, check it out. Okay. Then something that I would recommend, go underneath the tendon here and dilate there. That will help you.
do you
Okay?
use dilators for that, or
You can use a dilator, but dilator so it's easier to pass it, okay? So you have incision 1, incision 2. We go now lateral compartment, okay? And that will be just for the transfer. So then, the first tendon that you are gonna find here will be your tibialis anterior. Let's put this right here like this. We go like this, okay? That tendon there should be the tibialis anterior. Find the tibia. That's the only thing that you want to do. Put your retractor between the tibia. Right there. Sorry. That's your tibialis posterior right there. Okay. You guys see that? So then, review. PT. Navicular, medial malleolus, straight line. Medial crest, 1.5 centimeters.
The 1 centimeter? Because you said this other side was
Centimeter
and a half.
and 1.5.
Yeah,
Okay.
so that side was-
Okay, once you go to the tibia, the first tendon out of the tibia will be your posterior. Now, first tendon here out of the tibia will be your tibialis anterior. So why we want to do that? Because so we can pass it, okay? So check it out. So if I have my tendon right there here, and this is tibia, don't forget I need to pass that. If I just grab the tibia right here, imagine like that, I'm going like this, I'm going like this, and I'm gonna do this. Okay, and then the same thing, I can go right here like this, slide, and now I have, I can touch my instrument. You hear them? Okay, so that's something that you guys should practice. Tibial, move the tibial, then tibialis anterior out of the way, okay?
Do you always bring the tibialis anterior or laterally?
Yes,
Okay.
because you want to exit when you do the transfer just in front of it.
Okay.
If you go between the tibialis anterior and the extensor digitorum longus or more distal to the hallucis, you may entrap you deeper in your nerve. You don't want to do that. That happened to me.
I know you hate finger dissecting, but will
No,
you
no
run
finger
your
dissecting.
hand along the posterior aspect of the tibia just so that you move up your
No, you can
neurovascular
feel it.
studies,
You
or
can-
neurovascular
bundle?
bundle out of the way?
No,
back
because the
there?
neurovascular bundle will be right here. Okay? The neurovascular bundle would not be by the tibia. It will be, you have your tibia, your tibialis posterior, your digitorum, then you're gonna have your neurovascular structures. Yeah, so you're not gonna,
Okay.
yeah, it's gonna be deeper at that level. This is the most important thing, to be able to mobilize and I think that that's the most important thing here, that you mobilize and you feel like that, and like that. Same way that you had to do a giggly technique for the tibia. Same way. If I do a distal tibia giggly osteotomy, that would be the way I would do it. Okay? You grab both two and then you cut right there. Okay? So that's something that you should pass. Then location. So let's say that I want to go right here into this area. Well, be sure that you don't hit your superficial peroneal nerve. Try to see if it's not in the area. And you can see it right here. So just go just medial to it. Sure that you see it's right there. So just go right here like this. Okay. Go underneath the flexor retinaculum. And you're gonna need what is called the peon clamps. They're longer than these and curved. Okay. See, I'm going under like I'm scribing. And then I will exit there, grab it, and then come and pull it out. Okay? That's it. I mean, I don't want to do it. You guys can finish off from there.
What do you
Cut
use
it
to
here,
anchor it?
pull it out. I like to do biotin adhesive screws, but if you want to use an interferential screw, you can. This is your tibialis posterior, don't forget that. Okay, right there. So that's your tibialis posterior. Cut it, extend your incision slightly more so you can get a little more length. Pull out here. Then you're gonna go from here, you know, put this right here, feed it, bring it over, then go like that and bring it. Okay? Go for it.